gathering, but everybody who's here is a star. You're a galaxy together. I can't see you from where I am, and if I could, I'd be dazzled, but I greet you and I thank you for joining us. Perhaps if you'd like to do so, you will tell us who you are in the chat, and do, by all means, put up questions for the panel, which will be meeting later on. The first recommendation of the report entitled Creative Health, issued by the All-Party Parliamentary Group for Arts, Health and Wellbeing, was to establish a strategic centre at national level. Why did we think that was an important thing to do? It's because we believe that the experience of creativity, experiencing the creativity of other people, but more importantly still, experiencing your own individual creativity, can make a profound contribution to the health and well-being of individuals and of communities. And thousands of studies have underpinned that proposition. There has in recent years been growing recognition of that reality and the development of fantastic practice across the country. Our sister organization, the Culture, Health and Wellbeing Alliance, a membership organization, now has some 6,000 individuals and organizations in membership who are practicing creative health approaches in the health and social care system in the UK. The pandemic has starkly exposed challenges of mental health, challenges of inequalities, and indeed it has exacerbated them, but it's also highlighted the benefits of the creative health approach in beginning to address our problems of mental health, our problems of social and health inequality. But this recognition and this practice are still patchy, fragile, in many places still seen as marginal. So the role of the National Centre for Creative Health will, I think, be crucial in taking a strategic overview, extending and securing the place of creative health in health and social care provision. We are a charity independent of government and its agencies, but we work closely with government and its agencies. And our specific roles are to advance research, to inform policy, to promote good practice and collaboration, and thereby to foster the conditions in which creative health can be made securely integral in health and social care systems. Many of you have accompanied us for some years on this journey, and I want to make some thanks. I want to thank first and foremost Alex Coulter, our director. Without Alex's vision and passion and energy and practicality, the inquiry of the all-party group would not have developed as it did. We wouldn't have followed up so effectively the 10 recommendations we made, and we wouldn't, I think, be launching the National Centre for Creative Health today as we are. I also want to thank members of our advisory group, some of whom have been with us since very early days, 2015, all the way along this journey. I want most fulsomely to thank our funders, Paul Hamlin Foundation and Welcome, who have consistently and loyally stayed with us and supported us. Their support is deeply valued. I want to thank some of our partners, all of our partners, but I will name King's College London, Imperial College Health Partners, the Arts Council of England, and there are others I could name. I want to thank our founding trustees, Helen Chatterjee and Bill Bower, and we shall shortly be appointing more trustees. And I want to thank the Secretary of State for Health, Matt Hancock, for his recognition of the importance of social prescribing, for making it possible to establish the National Academy for Social Prescribing, and for the leadership that he has chosen to give in helping to establish creative health as part of the mainstream of provision. Our first speaker today is a friend and colleague from the House of Lords, Victor Adebowale. Victor, as you will know, is one of the country's leading social entrepreneurs, a leading turning point over many years. He brought to something like 100,000 people a year support in terms of health and social care interventions. He was for some years a non-executive director of NHS England. And about a year ago, he became chair of the NHS Confederation. Victor, thank you for joining us today, and we look forward to hearing what you have to say.
Thank you very much, Lord Howarth. I really appreciate you giving me the opportunity to address such an august body of people who have, in my view, the future of the NHS and the health and care system in your hands, in your imaginations. I just want to say a couple of things. I've got 5 minutes, so I'm going to be strict on time. The first thing is that the Confederation, which I chair, is very much talking your language. If you look at our reset campaign, which I won't go into in great detail, it's on the websites and everything, it says really two things. One, the pandemic is a massive opportunity to learn. We can't have over 120,000 people dying and not learn. It's an insult to their memories. We can't continue to do what we've always done because the same results are unacceptable. So we have to reshape the health and care system as we emerge from the pandemic. Coronavirus, as Lord Howarth has said, has changed the NHS and social care system beyond measure. It has precipitated rapid transformation, and it's highlighted the three priorities that some of you will have heard me talk about before. The NHS and social care system is often caricatured by its complexity, and I always think it's the job of leaders, if they pretend to be leaders, to try and simplify that. So I always think there are only three things that really matter. And Rob has heard me say this before, and perhaps James as well. It's nice to see you, both of you, because you're both people I admire. There are only three challenges really. Equity, which isn't the same as equality. You know, all of you will work in regions, I know Rob does, where the active life expectancy of individuals is shockingly separated. I mean, I'm in London. In Barking and Dagenham, a woman has an active life expectancy of 55, i.e. that's when the body and mind starts to break down. Richmond upon Thames, it's over 70. It's not sustainable. It's not sustainable morally as well as economically and organisationally. So equity is pretty much key. The second challenge is access. Now, access for me is about how we design services. It's about commissioning services. Commissioning meaning the need to understand an individual and or a community such that you can build a platform for procurement and all that. And that's where the creativity comes in. There's a reason, I won't go into it because we don't have time, but there's a reason why Black and minority ethnic groups have a worse experience and worse outcomes in every priority area of the long-term plan. It's not an accident, it's a rational reason. It's the way we have designed services and interventions for a long time, including our response to the pandemic. And that involves workforce design, involves commissioning, involves service design, by which there's only one mission for workforce design, and it's this: you have to create positive value transfer, right? Which means that for a patient citizen, the fewer places they have to go to get an outcome, the better for them and you, right? Anything else is negative value transfer, and the taxpayer shouldn't be paying for it. It's not difficult to get your head around. And the third priority, which is often undiscussed, and I'm always worried about the things that aren't discussed, because the future's created by the things that we don't discuss, not the stuff that we do. And some of you heard me say that before, but it is true, and it's often worth repeating, is digital. And it's very simple, you know, in conceptual. If digital isn't helping you with the first two things, i.e. equity and access, why are you using it? But believe me, it will be a major change to the way in which we deliver health and care in this country at integrated system level, at place, at neighbourhood. It is a game changer, and it has the potential to both create health and destroy it. But we are not talking about it enough, in my view. So those are the three priorities that I think the health and care system has to focus on. And I think within that, the arts and culture are writ large. I just think it seems to me a blinding glimpse of the obvious that creativity in the context of arts and culture at the seat of what makes us human and what makes our ability to translate our experiences into something meaningful And it's interesting that in Wales, the sister organisation to the NHS Confederation, the Welsh Confederation, has a partnership with the Arts Council. And I've seen the results of that partnership when I've been in Wales, and it is positive, it is creative, and it is embedded. And it has a huge impact on health inequalities and health equity. So my final point would be, I would hope, in fact, I know that my organisation wants to work very closely in partnership with you. I think we want to work very closely. We want to develop a practical way forward in doing so. And I look forward to doing that, because the future of population health will not be about doing what we've done in the past. It will be about new forms of leadership. It will be about new forms of outcome delivery. And it will be about the focus on the intention, which is better health and care for all of us, but with a focus on those people at the sharp end of the inverse care law. Thank you very much for the opportunity to address you.
Thank you, Victor, for that wisdom and that endorsement, and we certainly look forward to working in partnership with yourselves. Our next speaker is Rachel Clarke. Rachel is another friend. Her remarkable book, Dear Life, describes the values that drive her as a doctor working in palliative care, and her more recent, equally remarkable book, Breathless, is an eloquent and passionate report from the front line in hospitals during the pandemic. And Rachel also believes strongly in the principles of creative health. Rachel.
Thank you very much indeed, Alan, for inviting me to speak today. Hello, everyone. And as Alan says, I'm a palliative care doctor. So for most of the last year, I've been on the front line of the pandemic, either in my hospice or on the wards of my local hospital in Oxfordshire. And this has meant that at the moment, I'm basically a palliative care doctor who has seen enough death and dying over the course of the last year to last a lifetime. It's really hard to exaggerate just how hard, how traumatic the last year has been for NHS and care staff. You want to be kind and compassionate and loving if you go into healthcare. That, of course, is the reason why any of us do it. But how do you actually convey any of that in a pandemic when you are hidden away behind a mask and a visor and gown and gloves? How do you show any of your humanity at all to your patients? COVID has made that so incredibly difficult. I remember very early on in the pandemic last year, starting to care for COVID patients on the wards, that there was something really horrifying about our patients' experiences once they arrived inside the hospital. And it was this, it was that for every patient who went on to die from coronavirus, from the very moment they arrived inside the hospital, they were destined literally never to see a human face again, because absolutely everyone around their bedside, whether it was a member of staff or someone who came in to visit, would be masked. So they would never see another smile. They would only see pairs of eyes. And I found that very shocking. And another little vignette just to try and convey what it's been like on the inside for staff is something I noticed in the car park of the hospital. And this was that even though the hospital was closed to almost all visitors, you would sometimes see cars parked in the hospital with someone, a driver, sitting inside the car, just sitting there facing the hospital. And I realized that these were people who wanted to be inside. They wanted to be with their loved one who maybe had COVID or another illness, and they literally couldn't physically be there. So they sat in their car in an empty car park, just looking at the hospital whose doors they were unable to cross. And I found that incredibly poignant. I think all of us working in the NHS realised very, very early on that the greatest cruelty of COVID was precisely this. It was the way in which this virus separates us from each other at precisely those times when you need human contact, the most, and it spreads through speech and touch. These are the means through which normally we share our warmth and our tenderness and our love with each other, but they're shut down by COVID. Set against all of this, the year we've just had, hospitals being overwhelmed, running out of intensive care beds, staff, all of us working at the absolute limits of our capacity. You might think that there has been no space at all for creativity. Surely that's a luxury, it's an add-on extra. It can't be an integral part of what the NHS has been doing. I would actually argue, from my experience, the exact opposite. I would argue that there has never been a more important time in NHS history for staff to conduct themselves with imagination and creativity, and this has been necessary in order to surmount those barriers imposed by COVID. Just to explain what I mean, there's a wonderful quote from the author Philip Pullman. He once said, "After nourishment, shelter and companionship, stories are the thing we need most in the world." And I believe that is true. That gets at something quintessential about human beings. We need stories, we're creative, we're not just animals, we rise above that. And in a hospital, that's more true than almost anywhere else, because what heals a patient isn't simply drugs or ventilators or scalpels. It is how a doctor frames things, communicates to our patients that they matter to us and they mean something to us, and we are not abandoning them, we're not leaving them alone. And I think all of that is a very special form of creativity, which of course enables staff to help patients build their own narrative in hospital that they matter, they're important, and they're being cared for. In the pandemic, I think NHS and care staff have done everything in their power to try and creatively keep on demonstrating to patients that they matter to us, we care about them. We've been there so often when family members can't. We have played their favourite piece of music at the bedside. We've read out a poem that a husband or wife wants their loved one to hear. We've sometimes worked with children. We've been the one who's crouched down on the floor and helped a child into their PPE so they can go to say goodbye to their mother who's dying of COVID. And we have watched them set off down a hospital corridor trailing a plastic apron behind them, because nobody builds PPE for children, it's only made for adults. All of that has been an act of imagination. It has been an attempt to creatively build a trusting, loving relationship with our patients, despite everything, despite all those awful barriers that COVID has imposed. And so to sum all of that up, I would argue that although this last year has been very focused on intensive care, ventilators, tech, high-tech interventions, really what the bulk of us have been doing in the NHS has been what I would describe as intensive care of the humankind. And I think that's the glue that holds the NHS and care together. It has been about creatively finding ways to express to our patients and their families that they matter, they are important to us, and we will do whatever we can to help them. And that is a creative act of rewriting human stories every single day of this pandemic, all the way through. It has been incredibly valuable and precious to staff as well as patients. And so I would argue in one sentence that the NHS simply cannot have too much creativity, and COVID proves that more than anything. Thank you very much.
Thank you, Rachel. And you and your fellow healthcare workers have certainly done everything in your power to ensure that there is humanity in healthcare, that creativity and imagination do play their part, that the stories are told as they should be. And of course, as you say, the profound benefits for the staff as well as for patients. Thank you for describing all that so eloquently, and thank you for your support for what we're doing at the National Centre for Creative Health and what we mean to do in the future. We now turn to Lucinda Jarrett and Pauline Boyer. Lucinda is Director of Rosetta Life, working on a program called Stroke Odysseys. And Pauline, who is a nurse, experienced a stroke and has been on the Odyssey with Lucinda. So Lucinda, Pauline, please tell us about it.
Thank you very much. It's a real privilege to be here, and what an extraordinary place we've reached in the growth of arts and health, to be at a place where we can launch a national centre for creative health. I'm going to talk first, and then I'm going to introduce Pauline, and then we're going to show you a very short film about the work of the ambassadors. So as you kindly said, I'm Artistic Director of Rosetta Life, and our mission is to provide creative services for people who are living with life-limiting illnesses. The idea is that those creative services enable people to find ways to tell their story. And in so doing, they not only gain confidence and agency, but transform our understanding of illness and transform the stigmas attached to the perception of illness by creating performances themselves. Our work began in hospices. We pioneered digital life storytelling before people knew what a digital camera was. So we've been working with digital since the very beginning of our work in 1997. In 2010, we began working with neurological rehabilitation, and that's the program I'm going to talk very briefly about now. So Stroke Odysseys is a post-stroke performance arts program. It began on the wards of the National Hospital for Neurology and Neurosurgery, but it was really kick-started with a grant from Guy's and St Thomas's charity when we had a period of 12 months to co-design an intervention with South London stroke communities. And co-design and co-production are essential to anyone who works in devising performance, but it's essential now more than ever if we want to be able to listen and give people voice. So we learned not only that performance was important, but we also learned that co-production was essential. What people said again and again was that their voice was being heard, and it needed to be. Now the programme exists on the wards of NHS trusts. As a 12-week programme, it exists in the community. And out of that performance programme, we train a network of stroke ambassadors who advocate for life after stroke by working in hospitals, supporting the artists, in the community and touring. And it's my huge privilege to ask Pauline Boyer to expound on that. Pauline is a co-founder of the programme with us, and she's been with us since the very beginning. Pauline, would you like to tell us a bit about the role of a stroke ambassador and your vision for how you'd like to see that role grow?
Thank you, Lucinda. I wish to thank, I'm so happy to be among you. As Lucinda has said, we are one of the ambassadors and the stroke survivor, in which we started this thing from the beginning with Lucinda. When we started with our program, we think of how we can encourage people more so that we have many people in the society to know that if you have brain injury or stroke, it's not the end of life. So we started going to the hospitals, telling people that with stroke, you can still do many things. Like me, I was in the house for 2 years. I can't go out, I can't do anything, but I was encouraged to join the group. So I try to tell people in the ward, we have days we go to them in the hospital. I used to go to St. Thomas's for my whole ambassador experience. So we go to each bed to encourage stroke people to get up and join us. We will sing, we will clap, we will enjoy, so that we life off our sorrow, that for them to know that they can be like me. They can't stuck in the bed. They should try their best to do what they can try and do. So we give them pictures to see, to emulate things in the picture, thinking of ahead, not going backward. You need to move forward. And it helps a lot for some clients. Also, I noticed that after being discharged from the hospital, they don't have they send a transfer referral, but the occupational therapy or physiotherapists, they don't come in time to each one. At times, they spend almost 6 weeks before joining us in the home. So we decided to try and see some people in the community too, to encourage them to come and join the group so that they will be feeling better. And also during our program, we travel a lot to different countries, different cities, to tell people that this thing is not the end. Like me, I cannot wear my things for myself before. Now I can do some of it. Then we travel. I can be on the plane. I can be on the coach, on the train, going far off there. And everybody in the plane, we were in the train or something, we try to encourage ourselves, laughing, dancing inside. We really appreciate that one. But later, the COVID, the pandemic started. We are thinking of way forward. So Lucinda and their group, they asked us, do we need to know more? We said, yes, we don't want to stop, want to go on, because our plan is to go far to the communities and go to different countries too to encourage them, because brain and stroke is not the end of the world for you. You lift yourself up. Nobody can help us unless we lift ourselves up before people encourage us more. So, and the family too to help us. So we started the creativity, like the nurse has already, the doctor spoken last, has said. We do the same thing in the group. They teach us how to use technologies in which we don't know nothing about. We are able to work on the Zoom. We are able to be many people. We are putting many people in. The Bristol, Reading, they join, everybody join together to start on the Zoom and to create different activities. Some people that, again, they cannot talk well before. Some of them started encourage themselves and they speak better, in which I was there from the beginning, I can see some that are improving in their speech and in walking too. At times I don't use my walking stick. I can walk some few meters without aiding and anything, without aid. And everybody were okay, because during those periods too, we are doing exercise, dancing, talking, and people with some creative activities like artists. Like one of us started drawing everything. And in this group, we don't discourage, they don't discourage us. They encourage us more. Whether you do it right or not, they won't just shut you down, that don't continue it. No, we improve day by day. And we are so happy that everything is going as I think it should be. So the pandemic is the one delaying us to go further, but it's not stopping the program. We really enjoy. Thank you very much, Lucinda. And everybody, I hope you can understand our predicaments. Thank you.
Thank you very, very much, Pauline. As she said, the pandemic has driven us on forward and has enabled us, in fact, it's, as Pauline said, it's enabled all the groups to come together to create a national online platform where they've decided they want to change the story of stroke and create a platform where people understand you can create a new identity for yourself as an artist moving forwards. We're going to show a very short film. Thank you very much, Alex, for showing this at this moment, which was made before the pandemic, but it shows all the ambassadors together in performance.
The word is self-esteem, isn't it? Get your self-esteem back.
No sound.
Well, I'm more aware of other people now, you know.
Is that working now, Lucinda?
Yes.
Sorry,
it makes me realise that we're all overcomers, you know, we're all able to overcome. We'll drink to God, we'll drink to everything.
Yes, it has changed my life by how I say, and now we are progressing. The other half of my life is getting on.
So this workshop we've been going for, I have gained a lot from it. Why? Because you are able to express yourself. And the people teaching us, they're very kind. They can mix well with other people. They understand our needs. And when you make a mistake, they won't brush you off. We will laugh about it. We talk about it. And then it encourages you to come back the following day.
The sessions would have been all right on their own. We benefited from the session, but giving a performance, you gain confidence. Trafalgar Square, Whitehall, this bus terminates here. Top positions with.
I saw dancing and I thought, oh, brilliant, because my balance is poor. And I thought that's just what I want to do. So I went up there and asked about it, and then that's what made me come.
But no hard fast rules, just able to do what everybody can do and then take good things from that.
It engages every part of you. Yeah. Each and every small bit of the person, your personality is put into it. Yeah. I mean, it has the parts of the brain, you have the speech, you have the balance, you have the people around to talk to, and yeah, everything of you is there.
Thank you very, very much.
Thank you, Lucinda. Thank you, Pauline. In fact, you've given us a wonderful example of co-production in your presentation. It was really moving and impressive. And thank you, Pauline, for telling us what a difference it made to you to become a stroke ambassador, to find your life wasn't constrained as you feared it would be, to find you could not only walk but dance, and you can express yourself as you need to do, and as you did so brilliantly for us today. Fantastic. Thank you both so much.
You're welcome.
I'm next going to invite Jane Povey to talk to us. Jane, a colleague, a friend to Creative Health all the way through the whole project since 2015. Jane is a GP by background, a musician. She is also clinical lead for the Shropshire, Telford and Wrekin Integrated Care Service, therefore at the forefront of the profoundly important shift that's taking place within the NHS from that excessive emphasis on competition to a new emphasis on collaboration, within which we look forward to creative health approaches being integrated with other healthcare strategies. Jane. Jane,
thank you. Yeah. Is that working?
Hello, Jane. Yeah,
is that working? Hello. Sorry, just checking I'm off mute. Super. Hello, everyone. And it's great to be here celebrating the launch of our National Centre for Creative Health. So I've lived in Shropshire for over 25 years now. And some of you might wonder where Shropshire is, but essentially, if you go to Birmingham, then you head towards North Wales, you enjoy a really scenic journey through Shropshire on your way. So yes, I'm a GP by background, and I became interested in leadership and management out of sheer frustration that often services don't work as well as they can for patients. And this is disappointing for the patients, but also their families and all of us as staff working in the NHS. As Lord Howe said, I'm also a keen amateur musician. I enjoy playing my flute in our local symphony orchestra. Well, that was until COVID got in our way. But playing music is really important for my personal health and well-being. So a few years ago, I was seeing an elderly patient who had serious breathing problems. She was being seen by various doctors, physiotherapists and nurses and having all sorts of tests and treatments, but we weren't really getting to the bottom of what the problem was or how to manage it. So one day I asked her what she used to enjoy before having all these long trips to see various clinical professionals started taking up so much of her time. And she explained that she enjoyed singing in a choir. This made me think about what we were all trying to achieve, and we discussed what it would take to get her back to the choir. A friend offered to drive her to rehearsals, and we talked about how she didn't need to do more singing than she felt able to. Her breathing problems weren't going to go away, but they did start to interfere less with her life, and she enjoyed being back in her choir with her friends, was able to participate more than she'd expected, and it significantly boosted her sense of well-being. So this prompted me to explore what other creative approaches to health and well-being are available across Shropshire, of which there are many, but they didn't always reach those with the greatest need, just thinking back to what Lord Adebowale was saying earlier. So I therefore established a network with like-minded colleagues and people that were very interested in all of this to grow the range of creative offers available and then make them more accessible to those with the most need. So for example, people living in care homes and people with physical and mental health conditions. And we called ourselves Creative Inspiration. At that same time, I heard that the all-party parliamentary group for arts, health and wellbeing was convened. I wasn't really sure what that meant, but it sounded interesting. So I made contact with Alex to get involved. And really here today, what we now have is the rich evidence base for the benefits of creative health collated in the 2017 report. We've got an emergent social movement of people demonstrated by this event this afternoon who are all driven to make creative health available to all. And now we have a National Centre for Creative Health to help us on our way. And I think we can't underestimate how important the evidence is in order to demonstrate the health outcomes and the value for money for creative health approaches in order to be able to access NHS and social care funding when it's so scarce. So as clinical lead for our emergent integrated care system, I'll explain what that is in a moment, in Shropshire, Telford and Wrekin, I'm really excited that we're going to be part of the Creative Health Hubs programme alongside Gloucestershire, Suffolk and North East Essex and West Yorkshire and the Harrogate systems. You'll meet Ellen, Louise and Bob, who are the Rob, who are the creative health leads for these systems during the panel discussion later. But essentially what we're all after is trying to make sure that creative health is just part of everything we do through the movement towards integrated healthcare systems. So what is an integrated healthcare system? Essentially, it means that going forward across England, all the providers of health and care serving the people living in a geographical area, so for me that's Shropshire, Telford and Wrekin, will work more closely together to meet the needs of the population they serve. We need to use the scarce resources available to provide joined up care, improve health outcomes and reduce health inequalities. And there are already many examples of creative health approaches being part of the service provision, as we've heard some of this afternoon. But however, we've now got the opportunity to make creative health approaches integral to how services are commissioned and delivered, including, but not only through social prescribing. And through the Hub programme, we'll be able to demonstrate the impact and return on investment so that we can spread and scale this approach across the country. So to finish, I'm really optimistic today that working together with the help of the National Centre for Creative Health, we can look forward to all sorts of singing, dancing and other creative activity being simply part of how we do things across our NHS and social care systems. Thank you.
Jane, thank you again. We talked to the importance of evidence. but let me also mention the importance of leadership. It's you as a leader in your community who have brought together that network of like-minded colleagues and helped them find the way towards something that they instinctively knew was right, but they didn't quite know how to articulate, and the system wasn't helping them to achieve. And I'm very excited about this program of Creative Health Hubs, which will be one of the priorities for our new National Centre for Creative Health. We will be supporting you and the 3 other hub areas that you mentioned in every way we possibly can, so that you can be pioneers and demonstrate that creative health approaches are going to help clinicians and nurses and everyone else achieve their agendas and achieve medical practice of a more humane and a more effective, and dare I say it also, a more cost-effective kind. So, Jane, you've been an inspiration over a long period, and so you remain. Our final speaker is Christopher Bailey, Arts and Health leads the World Health Organization. Christopher commissioned the evidence review within the WHO Europe region that was led by Dr. Daisy Fancourt. Daisy, who has been a member of our advisory group, supported the APPG's inquiry again from the outset, and now supports and advises us for the National Centre for Creative Health. Christopher is about to launch London Healing Arts Week, and the NCCH looks forward very much to participating in that. Christopher, please speak to us.
Oh, thank you so much, Lord Howarth. It's great to be with you again. And I actually was so engrossed and moved by all the other speakers, I forgot that I was going to speak. But I guess let's begin by saying that it's rare that an idea should meet a moment so well as this one. We've heard from some of the other speakers the cruelty of this disease, of how people die alone, how people's aspirations and dreams have been interrupted or shattered, the anxiety of the economic consequences of the shutdown, and the disproportional effect on marginalized communities and underserved communities. All of this adds up to a second pandemic of a mental health pandemic. And I think the bottom line for me reminds me of a quote from Carl Jung, the Swiss psychologist, who said, "Loneliness is not the absence of people. Loneliness is the inability to express what matters to you most." And that's where I think the arts can do the most good. The arts historically can glorify what is wonderful about being human and our relationships and our experience, but perhaps one of the oldest purposes of the arts and one of the most meaningful aspects is how, as Lord Adebowale put it, we can find authentic personal meaning in misfortune, in disappointment, and the transformative ability of art to do that. Now, I'd like to say that I'm here to congratulate you on the founding of the National Center for Creative Health, but I'm really not. I'm here to offer my sincere thanks because, frankly, all of you have been pioneers in this area of arts and health, and we at WHO have been the beneficiary of that. Your work, as local as it may seem, has had a global impact. Not only did it inspire the report that Lord Howarth mentioned that Daisy Fancourt was the lead author on, but we've used the information from that report to do community works in the Yazidi community in Northern Iraq, in local communities in North Kivu in the Democratic Republic of the Congo to combat Ebola. We've used it in the Navajo Nation in the US, which has the highest morbidity and mortality rate of COVID in the US. So not only has your impact changed the world for the better, but I'd like to think that what we're learning around the world, we're going to feed back into the UK as part of showing that global, national, and local are not separate things, but a continuum, that we're all part of the same human family. Now, WHO, it being involved in arts and health, my program may be relatively new, but the idea isn't. We not only work at the local community, we work at the global scale. You may remember last year our Together at Home concert with Lady Gaga, but frankly, we've been involved in the arts from the beginning. And in fact, even before WHO, I remember when I went to university in the UK, my tutor was a guy named Jonathan Wordsworth. And he talked about his great uncle, William Wordsworth, and how Victorian doctors in the UK would often prescribe lines of his poetry for specific ailments. So this connection is not anything new, but I think certainly the urgency and the vibrancy of it is new. And in fact, our commitment to looking at the evidence in a more serious way is also new. I'm going to close by trying to walk the talk and tell you a little story about how I was able to use the arts, in my case, accidentally, to find a personal meaning in my misfortune. Now, I am virtually blind. I suffer from terminal glaucoma. I've lost over 95% of my vision. My optic nerve has been shattered. Now, I've been lucky. I've had access to assistive technology. I use a white cane. I've learned echolocation. I can manage. But for the longest time, it was hard for me to focus on what I could do rather than what I had lost. And one of the things that I had lost was my ability to engage with the visual arts. I refused to go to museums. I didn't want to look at paintings because to me, they were corrupt, they were polluted, they were a reminder of this gap in my life. Now, about a year ago, right before the pandemic, I was asked to do a performance at the Wellcome Collection on arts and health. And one of the things that I often do before I do a performance is to walk around the city, maybe enjoy a concert, some way of focusing my energy. And for that occasion, I was walking through Trafalgar Square for the first time since I had lost my vision. And I wanted to go to St. Martin in the Fields to enjoy a concert in that space and to feel the sound in that architectural space. But while I was crossing Trafalgar, and this was before the pandemic, I was so consumed by the crowd that I began to feel claustrophobic and disoriented. My heart began to race. I was filled with anxiety. I became totally disoriented. I became tempest-tossed in this crowd. And I ended up on the wrong side of the square next to the National Gallery, which was the last place I wanted to be at. But I entered it anyway as a refuge. And I found myself in this gallery, in a particular wing of it. And with my shattered vision, I began to recognize some of the paintings I was in front of. It was the Turner collection. And I saw these seascapes with the mist and the fog and the images coming out of the fog. And I began to taste the salt spray and realized that that saltiness wasn't sense memory from the painting. It was the tears running down my cheeks. And for the first time in that moment, I realized this artist captured the way literally I see the world. And for the first time, it actually occurred to me that it might be beautiful. And there is a wonderful alchemy with the triangulation of artist, object, and observer that can help us navigate the storms of our lives. It's easy to dismiss the arts as merely recreational, and they are recreational. They do give comfort. They do offer diversion, but not as an escape, but as a way of setting us on that journey to find that personal meaning, even in misfortune. Recreational, what does that mean? It means to recreate our sense of identity, our relationship to ourselves, to others, to the world around us, and to become the creator of our own future. That, my friends, is healing. Thank you.
Christopher, thank you for sharing that story with us and your own experience of the healing power of Turner's art in a moment of personal crisis. It's immensely important that the World Health Organization is now making the commitment that it is to the creative health agenda, driven by you with your personal sense of purpose and insistence. So we look forward very much to working with you and to beginning to see the fruits of that. My warmest thanks to all our speakers. I think we should have a break of a minute or two. The second half of our proceedings will be a panel on which you will have the opportunity to meet some of our very valued colleagues and allies, and perhaps get a glimpse of some of the partnerships and collaborations that are being developed. Alex is going to preside over the panel discussion. So I will hand over to Alex to initiate part 2 when she judges the moment is right.
Thank you, Alan. So yes, let's just take a 5-minute break and then we'll start again just before or at 5:02 if we can. Is everyone all right? Do you want to all slip away? Some of you have turned off your videos. Nikki, we were going to practice your sound in the break.
I'll come back in a minute. I'll see you soon. Yeah.
Okay.
Thanks.
Nikki, you are muted at the moment. I'm going to try unmuting. I'll try and unmute you, and it says ask to unmute. Do you want to go out and come back in?
Alex, we had a few people asking about the chat because there's been some fantastic information and sharing of information in the chat, whether we can save it and maybe send it to people afterwards. I have said that I just need to check that with you and Alan. And also someone did ask about if there could be a list of people who attended today. So that's also something to think about as well. So just to have those 2 questions, I know which are in the Q&A. I know there's lots of other questions in the Q&A, but I thought they were more practical ones that we could maybe just think about.
Alexis, did you say there was a question for me?
There was just a question, Alan. A few people just asked about the chat because there's been some fantastic information shared between everyone, whether we could save it and send it on post-event, and also whether there would be a list of people who've attended today to be sent around as well. So maybe
Sounds fine unless there is some ghastly data protection objection.
Can I just say to you all, I'm getting messages to say we are live. I know we're live. Our audience, we can't switch off. I've just said we're having a break, but just so you know, we are still live.
Well, I'm just reading through the chat. I didn't have the opportunity while I was sharing and listening to the presentations. It's terrific, the chat. I hope it can be shared or circulated if that's what people want.
Alexis, can you make sure we're saving all of the recording, so I think we get the chat as well, but if you want to copy and paste it at the end, just to be sure.
Yes, I'll do that. And I think just to say to everyone who's in the audience, if there is, if you do have a problem with that, with sharing that information in chat, please just email us at info@ncch.org.uk and we can amend or take your information out if you don't feel it's appropriate. So we then can send the chat around to everyone and not lose that valuable information.
Nikki, can we hear you now? Do you want to unmute yourself? No, not working. Tony's going to have to ventriloquize for you, Nikki. Never mind. Okay, it's 2:55, so I think we should start again. I have switched the screen view to gallery now, which I hope means that all of our audience can see all of the panelists, or as many of the panelists who fit onto the screen. So thank you very much. And I just echo Alan's thanks to all of our speakers. It was absolutely fantastic, that first half. Thank you so much. And some of our speakers, I think, are still with us. I'm Alex Coulter, Director of the National Centre for Creative Health. And Lord Howarth mentioned earlier that we have our other two founding trustees here, Professor Helen Chatterjee and Bill Bower. Helen's going to help with taking questions from the audience. So if you do want to ask a question, please do pop your questions in the Q&A box as we go through. Our panel this afternoon represents some of the organisations we are working with in England. We are also in discussion with colleagues in Northern Ireland, Wales and Scotland, and I hope that later in the year we'll be able to share more about that with you. Alan's given his thanks earlier. I also would like to just acknowledge the commitment of a number of people during the time that since the beginning of the inquiry in 2015. I'd like to thank our advisory group, the growing network of creative health champions we're now setting up, and many more people who took part in that inquiry and helped us on this journey, which has led to the establishment of the National Centre for Creative Health. I'm going to introduce our panellists and ask them to say a few words about their commitment to this agenda and what they see as the benefits for their people and their organisations. Earlier, we heard from Dr. Jane Povey, clinical lead for the Shropshire, Telford and Wrekin system. As Jane explained, they are one of 4 integrated care systems, or ICSs, as in the Creative Health Hubs programme. We also have with us Ellen Rule from Gloucestershire ICS, Louise Hardwick from Suffolk and North East Essex ICS, and Rob Webster from West Yorkshire and Harrogate ICS. So Ellen, then Louise, and then Rob, would you like to say a few words first? You'll need to unmute yourselves. So starting with Ellen.
Thank you, Alex. You gave us a very strict time limit of 1 minute. So, in 1 minute, you know, I think this is a tremendously exciting programme and opportunity, as you know, and getting the centre underway feels like the culmination of a number of years now of thinking about this. And my reflections on being part of this programme is that we need to think differently. I think you've heard that from the speakers this morning if we're going to address the problems that we see in our health system and in the issues such as inequalities and so on that have been described so eloquently before me. And I think this programme really gives us an opportunity to step into a different space and to do that. And that's one of the things that I have really felt to be a huge benefit to me, us and our organisation in Gloucestershire in doing that. It's really about being people-centred and taking an approach that has the real potential to change lives. And I've seen firsthand the profound benefits that it can. I also have experienced its power to engage and enthuse our clinical colleagues in a new way, which sometimes in this kind of slightly jaded world we can feel like we live in is so important, and bringing joy not just to people in their lives who are our patients and the people that we serve, but also our staff and our clinicians working in these services. And I think just as a sort of little addendum, Jane mentioned this as well, I do believe, although I don't put this front and centre, but it has the potential to be a highly cost-effective way of working as well. And in the climate we find ourselves in, then that's a sort of win-win-win all round. So yeah, hugely positive, and I've probably used my minute, so I'll stop talking. Thank you, Alex.
Thanks, Ellen. Thanks. Louise?
Thank you, Alex. I've learned that we cannot be an expert in all things, and I feel that we're all novices. However, through working together in a true collaborative partnership, we can learn from each other. And I think that's what we've done over the few years, and to start to become advocates for culture and arts, and how the arts and, more importantly, our voluntary sector organisations can be equal partners in helping us to address long-term conditions in a more holistic way, rather than relying on clinical interventions. It's important to embed personalised care as the golden thread into all areas of our work, including linking culture and arts into, I would say, social prescribing, because I lead on that, and using personal health budgets, thereby giving equal access to everyone. The arts touches and supports everyone from cradle to grave. For example, from PTSD recovery during maternity and labour to enabling a patient who is at end of life to be able to listen to their favourite music, as hearing is the last sense that we lose. Art and culture provides an outlet when words fail. It helps people express experiences that are difficult to put into words, whether it's drawing, painting, photography, dance, drama, or even experiencing green spaces. I've learned that through some of the work that I've been doing with many of our arts sort of organisations in Suffolk. So I'm so excited for Suffolk and North East Essex to be a partner of this venture and to ensure that we create a legacy. And now more than ever, this is the opportunity for the arts and culture to be the new ventilators for our pandemic.
Thank you, Louise. Thanks. Rob?
Hi everybody, my name's Rob. I'm a Chief Exec of a trust and I lead the West Yorkshire and Harrogate Health and Care Partnership. So from a trust perspective, we've put hundreds of thousands of pounds into creative work over the last few years with over 100 partners, because we know that there's a therapeutic value to creativity and the arts. Alongside that, there's obviously art therapy and dance and dementia and various other things that we do professionally. But those partnerships fundamentally impact upon people's lives. And as one of our staff, she has now said, when she was a service user, creative minds not only saved my life, it gave me a life. As a partnership of, in my other job, coordinating all of the organisations in a big patch covering 2.7 million people, I was delighted to see the all-party parliamentary group recommendations, and we said to ourselves, why don't we try and implement them? Why don't we take the 10 recommendations and do them here? And who wants to volunteer? And Calderdale, the place, you might have seen it on the TV, sort of Where the Heart Is, Gentleman Jack, all that sort of stuff, is reinventing itself, or actually taking all of the fantastic elements of the place and saying, look, this is a creative place. This is a place which is distinct and unique, and let's use the arts and culture to improve it. So Calderdale volunteered to be the place that would lead on behalf of everybody else, and everybody else races to catch up. So we're implementing the all-party parliamentary group here as a system because it's the right thing to do. You can believe that with your head, or you can believe it with your heart. There's enough evidence and there's enough of our being, I think, to put into this. And finally, the pandemic, as Rachel said earlier, has really underlined the importance of creativity. And alongside those dying in hospital, I would talk about the record numbers of people dying at home, the staff who care for them, and the record numbers of people who've not been able to leave the house for a year. And all of those are being supported in amazing ways through creativity and the arts.
Thanks, Rob. Well, this Creative Health Hubs programme that Jane, Ellen, Louise and Rob have been talking about is supported by NHS England, and we're really pleased to be in partnership with NHS England. And we have James Sanderson here, Director of Personalised Care, who is going to talk a bit about the partnership from his perspective.
Fantastic. Thank you very much, Alex, and congratulations to you all on this fantastic launch today. And it's been amazing to hear from all the speakers that have spoken so eloquently. And I've been ticking off almost in a game of individual bingo all of the things that I was going to say that people have already said before. We know very clearly that whilst medicine and the NHS and the service that's provided in hospitals and GP practices across the country is absolutely amazing and has been really forced to step up and support people in a way that none of us could ever have imagined over the past year. But it's really clear that, what makes us well doesn't just go in in hospital settings and isn't just the preserve of biomedicine. And we're starting to realise now, I think, in a way, that creativity and the arts and sport and natural environment and the way in which we can embrace activities and connection in the community are the things that are going to drive health and well-being. And I think that the National Centre for Creative Health, for me, is a key part of a brand new ecosystem that we need to develop to really improve health and well-being for the nation. And I'm really proud to support this through NHS England. We recognised in the NHS within the long-term plan that personalised care and within that social prescribing was an incredibly important part of the way in which we build a new NHS as part of those measures. And this is quite a bold move. We're the first health economy in the world to recognise this as part of the infrastructure of the way in which the health system should function. And I think that gives us an amazing basis on which to build all of the great work that's gone on by the National Centre. And I think working together collaboratively across the arts and culture with the National Centre as a key driver of this work is going to really release some fantastic opportunities for us to build different ways of enabling individuals to achieve their objectives. Thank you.
Thank you. Thank you so much, James. So the National Centre is also working with academic health science centres and networks in London and Manchester as part of our Creative Health Hives, which is a broad category for partnerships and collaborations. I'm delighted that Rowena Burns, Chair of Health Innovation Manchester, and Clive Parkinson, convener of the Manchester Institute for Arts, Health and Social Change, are able to join us today. Rowena and Clive are working together to explore knowledge exchange and support the delivery of the creative health agenda across Greater Manchester. So I'm going to hand over to them to reflect a little on the relationships with the National Centre as well. Rowena, are you going to start?
I'm going first, I think. Am I muted?
No, we can hear you.
Thank you. I thought you could. A word on Manchester first. This is a city with a long history of working in partnership and a long history of working in partnerships that cross boundaries and that ignore institutional relationships. And Health Innovation Manchester is a product of that. We bring together the leaders of the entirety of the NHS, 4 universities, local authorities, social care, community providers, and third sector organisations dedicated to driving innovation in health and dedicated to tackling the shocking inequalities in health outcomes that exist in our city and elsewhere in the UK. It is fundamentally important, and I see this so much working across these institutions, that we change how we think about health and move away from an institutionally driven perspective to a focus on the citizen and on place and on well-being throughout life. And we need to embrace, I mean, it seems so obvious listening to these amazing people today. It seems so obvious that the creative arts are so central to our being, to what makes us human, and that our emotional and physical lives are inextricably linked. The arts allow us to explore and understand those links, making us resilient, more empowered, resilient, and more empowered people are more likely to be healthy people. This launch today is incredibly important to me because for all the brilliant work that is being done, the transformation that we need is hard. It's hard. We are changing deep-seated cultures and behaviours, and we're working with partners who are challenged by day-to-day pressures, and we've seen that so starkly in the last year and beyond. In Manchester, we think we have an amazing opportunity to make that transformation, partly because of our history working together, and partly because, you know, with the vision of people like Clive, my good colleague, and others, you know, we can bring together people from right across our community, from our radical arts organisations, as well as mainstream partners as well. Very, very exciting, very proud to be part of today. Thank you.
Oh, sorry, Alex. Again, thank you, Rowena. Our burgeoning understanding of this relationship between creativity and health is at a key moment. We felt it today, we feel it. It's a critical time at which the National Centre can help galvanise things. And this is what it's about, that strategic element in that evolution of this arts, health, social change agenda. Across Greater Manchester, there's a real appetite and history for reimagining the ways in which health's understood and how human creativity might help address some of the poisonous inequalities that impact on everybody's public health. We see our collaboration as a way of connecting the strands of culture, health and well-being systemically, but where the people that live and work in the city region are central to that change, not separate, not disparate, but somehow connected. So our collaboration is about exploring knowledge that's not only generated through collective co-designed endeavour, but that focuses on the factors that influence everybody's health, where culture and creativity enable communities and citizens, regardless of labels, to consider themselves as valuable participants in a common venture. And if I can be cheeky, because that was 1 minute exactly, if I can be cheeky and just throw in there, central to all this as well, I really want to see us valuing the artists and valuing those creative practitioners, because they're everywhere. They're on the ground. They're working in institutions, cultural sectors, heritage sectors. You know, we really need to put them at the heart of this conversation too. And I think there are lots of people in the room that appear to be in that role. Thank you, Alex.
Thank you, Clive. So moving swiftly on with our 1 minute slot, Lucinda and Pauline from Stroke Odysseys spoke earlier, and they're part of SHAPER, a major research and implementation programme being delivered by King's College London and King's Health Partners, an academic health science centre. Nikki Crane and Tony Woods, the SHAPER programme managers, have joined us, and we'll be working with them to spread the learning from SHAPER as it emerges. I'm not sure if Nikki can speak, but now she looks like she might be unmuted.
Yes, I think, can you hear me? I've swapped computers actually, so hopefully you can hear me for a moment. So yeah, I just wanted to speak very quickly from a number of hats really, as a freelancer working in this field for a long time. I couldn't be more delighted that this is happening now, to feel part of the national network, and I can feel the local pull towards each other that's already happening. So something tangible is happening, and I lead the Arts, Health and Wellbeing work at King's College, and under that King's College remit of leading Arts, Health and Wellbeing comes my work with SHAPER and working with Tony on that. And just to remind people, and as Alex has alluded to, this is a programme, it's a 3-year programme with 3 arts and health interventions, stroke, Parkinson's and postnatal depression. And, you know, we're looking at how we scale this amazing work, because we're all passionate about taking programmes that already have a good evidence base, but we want to, it's all about spread, and this of course is where the National Centre for Creative Health is really going to help, and that we'll join up. But you know, you can still scale and still miss embedding this work in the mainstream of the health and social care system, and so that's the core of what we're doing. We want people to stay in touch with us. We can put details in the chat. Running a number of seminars to connect people with us, and that's probably enough to say for now. But just to say, we want to be working with you, and we are going to be one of the people that you're having a relationship with, and I hope that'll be long and fruitful. And we have lots of things up our sleeve at the moment that we want to share with you. Things are brewing already.
Thank you. Thanks, Nikki. Do you want to add something, Tony?
Only very briefly, just really, well, thank you personally for the invitation for today. So thank you to Lord Howarth and yourself, but not only for that, for actually for all those people involved who in the writing of the Creative Health Report, because without that health report, we wouldn't be in a position where we've been able to persuade Wellcome Trust to invest in our programme. And it was really sort of King's desire to sort of get in there first and sort of tackle those recommendations that meant I was able to begin the most exciting part of my career, I think. So working alongside Nikki and putting together a huge program to really tackle this problem of evidence and trying to persuade those people who are wedded just purely to the sort of biomedical model of healthcare that actually the arts are important and do have a lot to offer. So we're not only just trying to look at evidence that they actually work, but we're also looking at the evidence of around the implementation and also the economic viability of arts in health programs. So it's been a wonderful time for me so far. Obviously, COVID has brought its challenges, but we've put all our programs online now. And it will actually enrich the study, I think, because we'll be able to have a comparison between face-to-face interventions and online interventions. So we're looking forward very much to working with the centre and all the hubs and all the people who are involved today and watch this space.
Thank you, Tony. So across England, the Culture, Health and Wellbeing Alliance is a very important partner for us with their extensive reach into the practice field through more than 6,000 members. Esme Ward is chair of the Culture, Health and Wellbeing Alliance. The Lived Experience Network, the LENS, is closely aligned to the Alliance and to the National Centre, and Ma Rana, London champion for the LENS, is here to represent them. So Esme and Ma, would you like to say a bit about your commitment to this partnership and the creative health agenda?
Absolutely, and what a privilege to be here. It feels both quite an emotional moment, but also a moment of real hope. So yeah, the Culture, Health and Wellbeing Alliance, as has been mentioned, 6,000 members now, all invested in bringing culture, creativity, health and wellbeing together. And I think we're driven by the collective power, and that is some power of those members, from artists and practitioners to larger organisations. And put simply, really, the visions for a healthy world powered by creativity and imagination. But I suppose how we address health inequalities, how we forge enduring partnerships and move beyond what one of our members, I think beautifully and rather depressingly described as the promised oasis of sustainability, remains an issue and a critical issue for all of us. This past year has seen countless examples of work that places autonomy, empathy, vulnerability, and creativity in our communities at centre stage, and we really want to build on that. And I think if today shows anything, it's probably that the future's collaborative. And so we're so thrilled to be working with the National Centre, and we will work with you any and every way we possibly can to ensure that we come closer to realising the potential of creative health.
Thank you, Esme. Ma?
Yes, thank you, Esme. Following on from that, the LENS, which is the Lived Experience Network, is a network of people across England who have lived the experience of creativity and culture, having had a transformative effect on their own health and well-being. So the LENS is committed to the creative health agenda, because our aim is to ensure that the voices of those with lived experience remain at the heart of the creative health movement, and that our stories are heard and they're shared, because storytelling is a powerful tool. And so the partnership with the National Centre strengthens our outreach and impact as an organisation that advocates for the value that creative and cultural engagement has to health and well-being for everyone through all stages of life. So as an organisation, we look forward to being part of this incredible, sort of rich and inspiring journey ahead, and just adding what value we can to what happens next.
Thank you, Ma. Professor Hilan Chashji, as many of you will know, is a leading light in research in this field. At University College London, they've just launched an exciting new interdisciplinary science and arts masters in creative health, and we will have a working relationship with the students and staff on the mask, as it's called. We're also in discussion with a number of other research centres around the country about how we might support this important research agenda. But I'm going to hand over to Helen now, who's going to help, because she's also a trustee, of course, help with seeing if there are any questions from the audience that she wants to put to the panel.
Thanks, Alex. We've had some wonderful questions. Thanks to everybody. Apologies if we don't get to them all. So I'm going to start with a question that was posed right at the beginning of the session, actually. I can ask all of our panelists to respond to this. I was thinking in particular that Rob, Ellen and Louise have already talked a little bit about this, but it's a question really about how creative organisations are going to be involved in designing the new ICS integrated care system structures proposed in the NHS long-term plan. And several of you talked about these creative health partnerships. And I wonder if one or two of you might like to address that question. Who'd like to volunteer? Rob,
I can start if you like, Helen, if that helps.
Lovely.
So I think the good thing about the ethos behind the white paper and integrated care systems is that they're focusing on tackling health inequalities, thinking about variations in care, thinking about how we use our resources together, and now thinking about the social impact that we can have. And that ethos is a good one. And then I think what the intent, and Simon Stevens was talking about this, I think at the Health Select Committee today, the intent is to have very little in the legislation so that people locally can design what works for them. And that's certainly what we found is good. There's not much prescribed in terms of the structures that you should have, but just a desire to make the most of the collaborations that you can have. And I think that phrase earlier about the future's collaborative is the one that I would point to. So in places like Leeds, for example, with its Creative Institute, or Calderdale with its ambitions, you can have the partnerships that make sense. I know David Quillen, for example, is on this today, and he used to be the chief exec of the Square Chapel, but now works with us. And bringing the sort of organisations like the Square Chapel, like the Peace Hall, alongside Calderdale Council, the NHS hospitals in Calderdale, the GPs, primary care networks, and everyone else to think about what's the partnership you like in that place is essential for delivering joined up care. So I think if you've got strong networks in places and in systems, as Rowena was talking about in Greater Manchester, as we've got in West Yorkshire and Harrogate, that's great. If you don't, push some doors down and ask why not. You know, because you've got the potential to design what's going to work for the citizens and the people who live locally.
Shall I add something? Yeah. So thanks, and it's a really interesting question and quite a tricky one to answer succinctly. I think Rob's covered some of what I would have reflected as well myself, so that's probably good because we're thinking along the same lines, which is that one of the complexities and good things all in one bundle about integrated care systems is that there is this freedom to respond to what you have locally, but that does mean it's not a one size fits all. So what's true in one part of the country may not exactly be true in another part of the country, which for people looking to engage and on the event today, I realised does add to the complexity about which door is it you go and bang down if you feel that you don't have that local access and you're not involved. So, and also some of our ICSs are bigger and some are smaller. In our community, we have neighbourhoods, which are probably a layer below what the NHS calls place. We engage to the district councils, and we have networks that we use through our VCSE networks that exist. So we have a VCS Alliance. We're connected through to them. We have an Enabling Active Communities board and connections through the districts and so on. And I imagine we're pretty in common with lots of other areas where those networks are built around localities, either at what some of us call neighbourhood and some of us call place, engaging through our local authority partners and other VCS networks that exist. So if you're not seeing it happening in your local patch, try there. If you're still not seeing it happening, then, you know, beat down the door of your local NHS organisations. But that's certainly how we connect. And in our system, they're very involved in helping us shape how we deliver and think about our future model for integrated care systems and so on. But that probably is different in different parts of the country, depending on where you go.
Helen, could I come in and make one further comment just on this? And it's about money, actually. If we're ever to get the arts as a mainstream part of health and social care, then we need funding regimes nationally to be changed. I think the richness of what is happening and the scale of what is happening with very little resource is extraordinary. But it's only extraordinary in the sense that it gives us a feel for what would really be possible if funding regimes were adapted to allow the costs and benefits of the sort of work that we're talking about today to be spread across, to be counted across the total system. And, you know, I see Rob nodding. We're all very familiar with the perverse incentives, the fact that costs arise in one part of the organisation and benefits in another. And we need that to change, and ultimately that will need national action. So I think that forms part of the NCCH influencing agenda going forward, I guess.
Wonderful. Thanks, everybody. I'm going to move on, if that's all right, to another question, a really great question from one of our attendees, Keith, who's talking about his perspectives as a person with dementia. And he's asking if we can ask the panel about their thoughts on how creative arts can contribute to building resilience. And I know, Pauline, you talked a lot about this in your slot, and I wondered if you'd got any more comments, but invite any of the panel to make a comment about this. Got Rob volunteering, Lucinda. Lucinda, do you want to go next?
I'll go while Pauline, you need to unmute. So there, just to say, Pauline, the question was about resilience, so how it builds your capability to live independently. Do you think that the performance arts program builds your capability, your capacity inside yourself to live an independent life?
Yeah, I can do it. It helps because all what we need is that we need to put the disease or stroke or any brain something that you have. You need to try and put it aside and follow the system. How the coordinators, what they are trying to achieve from us. By doing that, like me now, I was paralyzed on one side, right leg and the right hand. But now I can do more. I tried through the encouragement, I was able to take a bus. At times, some people will say, excuse me, I wanted to sit down because I don't look like somebody have any problem. So unless they see the stick, they will ask me. So you can try and emulate some things, what we are doing. If you like it, if you put it in action, you will see that you will forget most of the things in your mind about what you have. And gradually, to be able, even not medication alone helps. Talking to people like you, it helps.
Thank you. I think that's really helpful. I think it is true that, you know, at the beginning, you would never have thought you could get on a plane to Belfast and perform at Belfast International Festival. But you did, and that was amazing. But I think the key thing, what I think it's about, the group always say we did this. So yes. It's not about what the arts can do, it's about how the arts create community and inclusion and enable people to do for themselves. It's about the one thing the arts gives you is it gives you voice and expression. But if we really galvanize that, it can create a dynamic community. And that's what's really, really, really important. It creates a dynamic, inclusive community of people who believe that they can look after each other. And the relational dynamic of performance arts creates that community. And that's where the arts is at its best. It's about relations. We come back to that idea of humanity and human story. If we build our humanity, our skills for listening, we're building our capacity to be a human being. And if our capacity to be a human being doesn't build our resilience, nothing can. Thank you.
Wonderful. Thanks, Lucinda. Thanks, Pauline. Mara, I wonder if you'd like to have the final word as we edge towards the end of our session.
Well, I was just about to kind of respond to that question about resilience, and I think it's about, from my experience of being a dementia carer and learning to embed creativity in daily life. So it was moving away from a deficit model, and working with what is there and building from the bottom up and growing strength from that.
Absolutely fantastic. Thank you. I'm very conscious of time, and Alex, I know that we don't have much time left, but we could continue addressing questions if our panelists have time to continue.
Yes, and also I think Alexis will gather all the questions that are in the Q&A box, and we can look at them. And if there are questions we can answer, we can send sort of frequently asked questions list to people afterwards. But I think maybe all our panelists could just put up their hand if they need to go. It's 3:30, or if you feel you want to stay on for a little bit longer. Hands up if you have to go now. No, everyone's staying. Okay, so Helen, what do you think? Do you want to take a couple more questions perhaps?
Why don't we? That would be great. James, I wondered if I could direct some questions to you. We've had quite a few comments about social prescribing, and Esme has raised the challenge of, perennial problem in our sector around funding and the issue of the financial exchange or lack of in terms of the provider end at the arts end of the spectrum. We had quite a few organisations and individuals asking about perspectives on that issue around the funding gap. I'm not necessarily asking you have the answer to all of that, but I guess just some insights about what we might do, both in terms of NASP and the National Centre for Creative Health, in thinking about taking that forward. As Esme and others have raised that issue of, we do need to think about how we fund all of this differently, potentially.
Thanks very much, Helen. And look, I think this is clearly a key challenge that we need to work together to address. I think there's a number of things that I would say about it. I think, the NHS has to look at new and innovative ways to support arts-based activities. And, you've heard from Rob what can be done with forward-thinking leaders in this space. So there's definitely more that needs to be done there. But we also need to recognise that the types of issues that we're dealing with in society are societal problems. It's not just something that's the responsibility of the NHS to address. And I think there's a wider conversation across government, across agencies, locally and nationally, around how we can work together as a society to bring together funding streams and support. So focus purely on the NHS should fund it all, I don't think is right. Nor should arts-based organisations continue to support people's health and well-being without receiving funding. And I think we've got to draw out a much wider conversation. I think the really positive thing here, though, is if you look a few years ago, even 3 years ago, we didn't have this same movement. We didn't have this same collective energy behind this. And it takes time to change systems, to change the way in which funding flows within society. But I think we've got the building blocks now for a really different way of working, and as I mentioned earlier, the NHS recognising the arts and culture as part of its strategy for development. But at the same time, the Arts Council in Let's Create, recognising health and well-being as a core part of the arts, is starting to bring a universal conversation to the table. And then, of course, the launch today, a National Centre for Creative Health, the National Academy for Social Prescribing that I run, we're starting to align these things now. And I think by continuing to have these conversations, by working together, we'll find different ways of being creative around the way in which funding can support the creativity that we also need in the system.
Brilliant. Thank you, James. And we look forward to continuing those discussions. I wondered if I could ask the panel to think a little bit about digital. We've had a question from Andy about issues around digital access, digital poverty. Lord Adebowale talked about the importance of digital. And I wonder if anyone's got any comments or thoughts about those challenges for people who don't have digital access. Lucinda is volunteering. Anybody else, please let me know.
Shall I go ahead? I think the digital poverty is important. It's been very hard. When we first we got funding to create an online opera and recognized the pandemic would enable us to bring all the regional companies together. And that created a national voice. Beforehand, the companies were fragmented. There's a lot of comment in the chat about the fragmentation that happens. I think what working digitally does is it enables us to work together. It brings us together in new ways. So it enabled that to happen. That was really significant. Now all the groups meet together and have a sense that they're a national network, that sense of being bigger than who you are, and that they can change the story of stroke, change the way they're perceived by an online platform. We can create a single performance in Reading, but an online platform enables everybody to come together, and people have viewed it from Singapore, Australia, and America. So that's key. But the digital poverty is a real problem. There are people who only have phone lines, who have been abandoned, who before said what was most important, it was being part of a company. People in care homes have found it really difficult to access our work on Zoom because the care homes don't have Wi-Fi, and we can deliver iPads, but they still need Wi-Fi in the care home. So there is an inequality in digital access that's real and fundamental. We can send out iPads, we can send out headphones, we can send out tripods, but without Wi-Fi or without one-to-one teaching for people who have no, who struggle online with aphasia or struggle with learning cognition, that we need to go one step further to bring full equity to digital access.
Very good point. Thank you. I've got Rob and Louise looking to come in. Thank you.
Yeah, just briefly to add that I think this is where I think partnerships and collaboration and integrated care systems come into their own, really, because the person who is in poverty is more likely to have a mental health issue, more likely to have a long-term condition, more likely to be older, more likely to be frail. You know, during this period, more likely to be shielding, therefore more likely to benefit from some support for their digital exclusion from the health and care system. And if the same support could then be extended so that they can access creative, cultural media, fantastic. So I think we just need to get into a space where we can have one supportive intervention around digital inclusion, which then has many benefits for all of us.
Thanks, Rob. Louise.
Thank you, Helen. I just wanted to mention a couple of pilots within Ipswich and East Suffolk. So we've been working with our local borough and district council, East Suffolk Council, who we commissioned some grand pads, they're called, and they are literally a larger iPad, but with its own cradle. So you don't need the internet, you don't need the broadband or anything. It's just a SIM card that goes in the back of the grand pad. And it has 24 hours, 7 days a week IT support for those people, but we're particularly using it for those people with learning disabilities. So it started with how do we link those people with learning disabilities to give around social isolation and loneliness through the pandemic, to ensuring they still have that annual health check, to linking that with social prescribing and supporting those people and giving that holistic look. And from that, we started to put in exercise programs, because you can personalize it to that person. So you can put music on there. They can choose what music they would like. So we started putting music on there for those patients or clients. And then they started dancing, and they started Zooming their friends, and they started then, and that was in care homes, in sheltered home accommodation and everything. So they started then having a few competitions, but then we started doing a little bit more creative things, and it's been an absolute success. But, you know, it comes at a price, unfortunately. But we do have, I think we've now commissioned over 100 of them, and we've done some additional funds through NHS England and our regional team in piloting 3 different areas on this. So I just wanted to just give you an example of where digital, for those people who haven't got access, how we've done that and how it's made a massive difference to their lives.
Brilliant, thanks Louise. And also would direct people to the Culture, Health and Wellbeing Alliance did a fabulous report which contains numerous case studies from across the country about organisations and how they responded to the pandemic. And there's lots of lovely examples there about visiting museums, other arts organisations, visiting people's doorsteps, using telephone systems. So it's their shielding and isolated report. So please do have a look at that. I'll post it in the response to questions. So we've got several more questions. One of these questions is very much, I guess, about what we might think about the future of the National Centre for Creative Health. It's from Lapidus International. Thanks for your question. It says, will the National Centre for Creative Health have a role in thinking about standards, guidelines, and possibly regulations for the creative health sector? So I'd be really interested in getting panelists' thoughts on whether you think this is something that the National Centre for Creative Health should do, and if so, what might some of our responses be around those sorts of standards and regulations? Anybody want to come in and address that?
Hi, this is Clive. It's just a quick one and nothing too strategic and nothing too thought out. It was just the word kind of regulations. You know, the word regulations jumped out at me. Yes, I see, you know, we think of the nice guidance and it's great. And I know it seems to be kind of a research dream to be cited as nice guidance and rolled out. But how do we regulate something as fluid and messy as art and creativity and culture? So there is something about working safely, and there is something about supporting artists and training. I think those are some of the key issues. Regulation, I think it could be tricky territory unless you're working in very explicit clinical environments. So, you know, if you're working in that kind of setting. But as I think it was either Rob or James said before, health is stuff that happens on the streets, in people's houses, in schools, you know, so different contexts demand different kind of ideas. And I don't know what Alex or anybody else would think about the National Centre and that kind of role.
I don't think I'd like to comment on that at this point. I think on the basis that the work is so collaborative, it's something we can discuss. But I would share some of your concerns, Clive, I must say, around the nature of the work and creativity. But as you said, issues around safety and good practice and support for practitioners is very current concern for lots of people. Lots of people are talking about that.
And it sort of follows up from a question from David, which was around starting a dialogue with NICE. And I think definitely those sorts of conversations we'd be interested in. As Clive says, we're definitely interested in those conversations, aren't we? Whether that would lead to necessarily guidelines, I think is more perhaps a question that relates to another really important topic, which is evaluation and quality and efficacy and all those research aspects. And that's definitely something we will be exploring through those sorts of links, for example, with the academic health sciences partnerships and the networks. I've got quite an interesting question here about, I guess, some of the sorts of buzzwords that we might use across the sector, from Phil, who says quasi-academic words such as culture and agency, empowerment and narrative, and even creativity can be off-putting tokens in the wider world. If this is a problem, how is it to be addressed? I don't know if people want to have any thoughts on that. This came up a little bit at last week's International Social Prescribing conference, where we had about 1,000 delegates all discussing this topic of these sorts of buzzwords that we're very familiar with. And if people have comments about that, I'd be very interested to hear your thoughts. Are they off-putting? Should we be avoiding them? Rob looks like he's got.
So we've got an organisation called Altogether Better, which we host in the Trust, which looks at, I'm going to use another buzzword, unfortunately, the liminal space between worlds. So when you go to the GP, they'll talk about, the practice. So they'll say, we've got a practice, it's got partners, we prescribe medication. Whereas we go to the doctors to get a prescription to go to the chemist. And what they say is that there's a gap then between people's understanding and experience, because the language is different. And it creates a power dynamic and it creates problems. So they work at how do you overcome that and how do you change it so you get a much more fruitful collaboration between people and professionals And I think the same thing could be applied here. You know, what we've got is an enormous number of incredibly creative and talented people who find it difficult to access the arts or connect because of the language we use. So I think if the centre could think about that, I know the Arts Council are really interested in that. How do they get more people engaged in the arts, and how do they get more diversity? And I think this liminal space between the real world and the art world, if you like, or between the NHS and people's real lives, is one worth exploring.
Just say something, Hannah.
Go for it, Nikki.
I mean, I'm stating the obvious, but I just think it's really important that we adapt our language to our different audiences. You know, it doesn't take too much effort if you're talking to clinicians. You know, it can be quite a creative exercise in itself, actually, to think, I'm communicating with this person who understands things in a particular way. I guess my feeling is that we need to go that extra mile all the time to connect and not be precious about our own language and say, well, I'm not going to compromise this because, you know, we're in the arts and we do these things. I feel exactly the opposite, that we need to bend ourselves out of shape, and we can always pull the rug back a bit afterwards. I think that's my strategy. And actually, we've called our arts programs arts interventions, and we've been criticised for calling them interventions because we were trying to fit with the clinical language. But I just think, you know, stay on your feet. Remember who you're talking to, and language. You know, we need to give up a few things and to speak to people in something that they understand, and then later we can exchange and ask them to think about the way we're expressing ourselves. So yeah.
Esme.
Yeah, and I suppose just to build on that, I couldn't agree more, Nikki. Really just thinking about why it's so critical to have people at the heart of the process. And I know certainly what we've been doing is using a lot more the language of care, which seems to cut through and means so much. Actually, talking about love and care, I met with a whole host of public health colleagues and practitioners, and actually we just framed everything in terms of thinking about love and care, and that resonated as much with them as it did with those in the arts. So I think really having people at the heart of the process and getting over ourselves a little bit maybe would be good. Yeah.
Pauline.
Yeah, in addition to what they have just said, I just want to say, if they can come down, like Lucinda and their group, they usually come down to our level, listen to what we are going to say, and from there, they take it up, not with big English. They talk with us so that we will emulate some of the things, either by singing or, and slowly, because stroke and brain something, it affects many things in everybody and different ways. So they know how to communicate with each one of us one by one. So if people can do that, it will help a lot on people with disability or disabled or something. It will help us a lot. If they can come down to a level, as you have said, but they should know what is really happening to this one. Because at times when we are doing program, if the person is speaking fast, some people will say they can't hear anything. The person should go down, or Lucinda will try to explain to that person how she can talk to us. So I think that's part of it, please.
That's a brilliant point. Thank you very much, Pauline. Keeping it simple. And I wonder if we can stick with you, Pauline, and Ma might like to come in. We've had a really lovely comment and question really about hope. And this person was inspired by Christopher's experiences with visual arts and yours, Pauline, in terms of your experiences of stroke. And this attendee says they're interested in people's experience of supporting people in challenging life circumstances to re-engage with recreation when you've lost hope. And I just wonder if Pauline, Ma, Lucinda, you might like to talk about just some examples about hope and rebuilding hope through arts and creativity.
Do you want to go first, Ma?
Yes, I'm trying to think on my feet a little bit. I guess if I kind of draw on my own experience and kind of working with different groups of people, it's in a way, it's just often it's just about being with the person first, rather than assuming that you're going to do something or deliver something, and to maybe kind of, and this idea of kind of co-creation. So maybe you might go in with a particular idea, but you should be kind of fluid and flexible to be able to respond to the other person. So I've just got my alarm going off because I meant to go to another meeting. Sorry, I'll switch off. So you can respond to the other person's needs. So you can kind of absorb what they need into maybe your kind of initial idea, so that they lead or disrupt your idea. So disruption is very good, I think.
Thank you. I think hope is a really important unspoken part of healthcare. I think hope is the invisible miracle in healthcare. And it was one of the things that two neurologists have said to me, is that without hope, you can't recover. So hope is absolutely an essential part of healthcare and stroke recovery. But then the question is, how do you give people hope? How do you give people the optimism? And I think one thing, as I say, is community. The other is, has always already been said, is this working from the point of capacity. And the one thing the arts do that no one else does well, I think, is this idea of beginning with a blank page and improvisation and working from the point where you have no expectation and no knowledge of what you will do, but you're working very simply as two human beings together. So that point of working from capacity, without knowledge, without expectations, encouraging flow, improvisation, and also I think the most important thing is a group of people living with brain injury who see themselves witnessed and heard by each other. If you're afraid to go out because you think a newly acquired disability gives stigma, the first person who needs to see you is someone who you can trust. So the first place you're seen is in a group of people like you who face and suffer and experience the same life experiences. So you're witnessed, heard, seen, and made visible, first in the community that support you, and then that community give you the collective strength to take it into the world and build a wider community. So this notion of hope is first instigated at the individual level between two people, then at the company level, then in the community, and then you can begin a process where hope becomes the trigger that enables us to create a caring city, a caring community, because we trigger each other's hope, our optimism, our empathy, and the relationship between empathy and hope is also interesting. If we feel each other's pain, do we then have hope for each other? Sorry, I should stop there.
Oh, that was absolutely beautiful. Thank you, Lucinda and Pauline and Mar, beautifully articulated, I think, all of your examples. I'm going to suggest we have time for one more question, if that's all right, Alan, Alex, which I think is a really important question and stimulated, I guess, by Rachel's very moving accounts. And it's from Alex. It's a question about how we see a role for culture and creativity in supporting health and well-being of health and social care professionals. And Alex says they're thinking specifically about likely mental health impacts of COVID. I wonder if any of our panelists would like to make a comment on that, either your work directly that you've already been doing within the community. I know many of you have been working very closely with health and social care professionals, or indeed are such folk. Who's going to volunteer? Rob?
I don't mind saying something about it. So from a trust perspective, you know, I've got 5,000 staff of my own, and there are 125,000 staff and 260,000 unpaid carers in West Yorkshire and Harrogate. And we know that they've seen and witnessed things that they never expected. So for all the statistics you see about people dying in the community, you know, the teams looking after people in their homes, away from their families, have had to endure a lot. So what we've got is a range of interventions to support people's well-being. And they're the usual traditional ones like counselling, pastoral support, access to faith and other supportive organisations, but also access to creative endeavours. So through Creative Minds, we've got a number of community rapporteurs, if you like, for asking people to talk through, what's this experience been like, and creating an archive. And that process itself is helpful and supportive. And then we've got a range of creative endeavours that people can get involved in to support each other, whether that's well-being through, our Black and Asian staff are putting on some Bollywood dancing classes, for example, to help people's well-being, but we know that their physical well-being will be supported by their mental well-being. We've got choirs for staff. We know they're coming together to engage in those sorts of activities is good for your well-being. So there's a range of professional and cultural offers that we're making for staff to be rapporteurs on what they've been through, but also to create and be together. And I think I can't agree more with what Lucinda said. This is, Viktor Frankl talked about man's search for meaning, and this is about finding meaning even in the darkest of places.
Thanks, Rob. Lucinda, you had your hand raised, and Nikki and Pauline.
I think James also. James, did you want to speak? You put your hand up.
Well, thank you.
I was just going to say that to direct people to the work of the Claude Ensemble. I was going to say amazing organisation who've been delivering arts for healthcare practitioners for I don't know, since about 2007. I think I first remember their courses, who look at voice and performance arts for healthcare, but also very much about a values-based system. How do you reconnect with yourself, reconnect with your values? And we've learnt a lot from them. Interestingly, now in all the hospitals where we work, we've been asked to do lunchtime sessions based on the same model that we use on the wards for patients, for healthcare staff. So I think that not to say we've got experience, but just there's a huge need for it. And I think that Claude have a lot to teach us nationally. They've grown a massive body of evidence for their work.
Can I just follow on to say, I was just about to say the very same thing, Lucinda. You and I are working close together, but now speaking the same. We've brokered a relationship between Lucinda and Stroke Odyssey's programme and Claude, because we can see that there's huge crossover there. And just speaking to Susie Wilson, who directs that programme the other day, it's the same issue as with so many other things, that they've got a fantastically packaged programme now, bringing GPs, linked workers and arts organisations together. That's just one small project that's happening locally in Southwark. And they're doing work, in different places. But the same problem comes up with how do they scale this work? Where do they go next? Even when they've got something tightly packaged, which is discrete and now is an offer that can go elsewhere, how can that happen systematically without something quite a lot further above their heads taking that on? Because it's very much an upward movement, and those of us locally try to help that upward movement, but then we reach a kind of glass ceiling, and this is where we hope the National Centre will help. This will be play a pivotal role.
I can say, sorry, Nikki, I was just going to say I can say a little bit about that in relation to the National Centre after James has spoken.
Okay. James, do you want to go next?
Thanks, Helen. I think this isn't about patients, carers, service users, staff. It's about all of us as people, and that's the brilliant thing about this, is that it's a universal enabler. Not everyone in society is going to benefit from a hip operation, but everybody in society is going to benefit from culture and arts and sport and exercise and the natural environment in their lives for health and well-being. So we've got to use this as a way of breaking down some of those barriers that we face as well. But this is about all of us recognising how we can live healthier lives. And And I think, you know, this is a great opportunity to do that through the universal connector that is the arts and culture.
Well, that's a lovely way to end. So I guess I'm going to hand over to you, Alex, and then Alan, hopefully for our final words. And thanks to all of our wonderful panelists. Really appreciate it, and the great questions.
Yes, thank you. Thank you, Helen, and thank you to all our audience. I just wanted to add to that last discussion around healthcare professionals that I do think there's been a lot of talk about co-creation and co-production, and I do think that that is the way forward, because we are then working together collaboratively, as Lucinda says, with the blank canvas, and we can work with the healthcare professionals and the artists and the people with lived experience and the clinicians and the commissioners and so on to work together. Then everyone will benefit from the process, and that is very much at the heart of the way we want to progress this work. But I'll hand over to Alan now, who might like to just say the closing words. It's 4 o'clock, so that's quite good timing.
It's been an inspiring event, and it's been made inspiring by the participation of so many people, huge audience, wonderful contributions from the panelists, excellent questions, and a shared sense of mission and energy and determination for us to work creatively together to ensure that creativity does offer the fulfillment and offer the benefits that we know that it can. So I think this launch has been just such a remarkable event. So absolutely matched, indeed surpassed the hopes that I personally had of it. My thanks to Alex and Alexis and everybody who's been involved in the practicalities of organising it. My thanks to everybody for coming, and my thanks to you all for your commitment to continue to work together to achieve what we know is so important and what we know we can do.
Thank you, Alan. Thank you, everyone. Now, we will be visible to the audience until the audience leaves. We can all leave, but I'll just hang around here until everyone has gone. So thank you all, and hope to see you soon.
Thanks, everyone.